Very good evening. Thanks to each and every one of you for being here with us today. I, Ankit Dogra, along with my teammates, Dr. Deepika Chhabra and Mr. Amit Saxena from Medical Services, Jagsonpal Pharmaceuticals Ltd, are very pleased to welcome you all to today's program on contactless remote patient monitoring of vitals in cardiac cases, organized by Mera Swaasth Physicians Network, supported by Dozee, which digital partner Jagsonpal Pharmaceuticals Ltd, makers of LycoRed cell protector, soft gel capsules of lycopene, zinc, and selenium for boosting immunity and cell rejuvenation. Dear attendees, if you have any questions, suggestions, or clarification, please post in the Q&A box. Please note this webinar is streaming live on the Facebook. The link is shared in the chat box. Also note, for future reference, we'll upload this webinar on our YouTube channel. Now, let us welcome Dr. G.S. Grewal, Convenor Mera Swaasth Physicians Network, to kindly initiate the program. Over to you, sir.
Thank you, Ankit, and namaskar and good evening to all of you. It's a pleasure to have you all over on this platform. And we had started it 2 weeks ago, but could not have the session last Thursday. But I may inform you that every Thursday evening, 4 p.m., we will be taking up issues that are important to standalone clinics and their services. The purpose, the platform which we have initiated is the platform of the Mera Swaasth Physicians Network. I would be subsequently, after the presentation, talking about what is this network and how you can benefit by being a member part of this network. Today's session is very important because it is a new modality which is now available to physicians of standalone clinics to enhance the scope and quality of their services. Remember, today you have a limited OPD, and it is only by enhancing your scope of services and quality of services within that group of patients that you are seeing every day. If you can enhance your services and improve the quality, you will be successful in retaining the patient base, and also it would help in your financial gains. So one of this lateral modality, as we say, which we are going to introduce today to the physicians of standalone clinics, is remote patient monitoring of vitals in cardiac cases. It is a pleasure for me and for the entire attendees and for the organizers to introduce to you the distinguished panel. We have with us, as chairing this session, Professor Dr. Harshvardhan, who was former professor and head of cardiology at the RML Hospital, and is these days the professor and head of department of cardiology at the Mahatma Gandhi Medical College and Hospital at Jaipur. Welcome, Professor Harshvardhan. Thank you for joining us.
My pleasure.
We have in the form of speaker, Dr. Apoorva Garg, who is the product manager and remote patient manager at the Dozee, the company Dozee. We have Mr. Atul Kumar, who's the regional head for Dozee. We have our distinguished guest, Dr. Poonam Gulati, a senior consultant in urology at the Batra Hospital and the president of the Indian Medical Association South Delhi branch. And to help us all to go through this session and support us technically, I must welcome Dr. Deepika Chhabra, Ankit and Amit Saxena and Ankit. So welcome to all of you. And now I invite Dr. Poonam Gulati to first initiate the discussion by his welcome address as president of the South Delhi branch. Dr. Poonam Gulati, please.
Thank you, Dr. Grewal, for those kind words and introduction. And I must congratulate you and Mera Swaasth Physician Network, because you are taking this Mera Swaasth Physician Network and offering the last mile connectivity that was lacking for a long time, and also I am very appreciative of the illustrious panel that is there today for this meeting. I am sure it will be very useful. As regards as the contactless patient monitoring that is required for the cardiac patient, we live in an era where at times we may not be able to get a hands touch and feel experience with the patient, but from what is available, and I have seen the Dosi mechanism in work, and their artificial intelligence protocols are very well geared to provide this security to the patients, the attendants, and to the doctor as well, as far as the transmission of the required parameters is concerned. So while all things are equally important, patient contact with the doctors and also the telemedicine aspect as far as this remoteless monitoring is concerned, but this also fulfills a very important need, because with this I have seen that there are many patients whose attendants are sitting abroad, and they are able to keep in contact with their parents as far as their monitoring is concerned, and they raise a red flag if the patient is unable to do so. So I look forward to a very fruitful session with our illustrious speakers, and I'm sure everybody will derive equal and good mileage, and our best wishes to your program now that it has become our program. Thank you so much for having me here.
Thank you, Dr. Gulati. Thank you so much for these words and for appreciation. And in coming time, we will be having a exclusive session for the members of the IEMA South Delhi branch. Just before I invite Dr. Apoorva to give her presentation, today's topic of remote, talking about contactless remote patient monitoring. Ladies and gentlemen, each word is important. Contactless remote patient monitoring system. Now, after all, this is a totally new concept, and I like to first draw your attention. What are health sensors today? So health sensors today are wearable, implantable, and digestible sensors to measure health parameters and vital signs wherever patients or their caregivers need. Mark the words wherever. These sensors help bring healthcare to the homes of patients and make telemedicine and preventive care possible. So this is the new concept. This is where the future is going. And when I said that you will understand that by this simple modality, you will be able to give better services to your patients and better look after them. Now, which sensor is used in a patient and a monitoring system? A monitoring system connected to a hospital makes medical assistance at home possible through the IoT concept. Please listen to this word, IoT. These are different types of sensors which can be used. You might ask me, what is an IoT? Internet of Things. Friends, this is the new introduction. Internet of Things describes the network of physical objects, which are called things, that are embedded with sensors, software, and other technologies for the purpose of connecting and exchanging data with other devices and systems over the internet. So you have devices. This is what the detail Dr. Apoorva is going to give, because they have come up with a very novel method. So the IoT devices are pieces of hardware such as sensors, actuators, gadgets that are programmed for certain applications and can transmit data over the internet to other works. So therefore, the difference here today, what we are going to talk is remote monitoring. So remote monitoring of vital signs provides the possibility of obtaining pre-ICU data, even to the point of using them to decide whether ICU admission is required or not. And it may allow earlier or safe discharge from patients of ICU. So it is being used at home and also being used in the ICUs to decide. So I sure Dr. Apoorva will increase our knowledge about this new method, which I repeat, standalone clinic doctors can prescribe from their clinics. So Dr. Apoorva, who's a product manager with Dozee, I welcome you and welcome your presentation, please.
Thank you so much, Dr. Grewal, for your kind words. Good afternoon, everybody. It's a pleasure for me and Team Dozee that we are able to present a device and to share the technology which we are using, which will be revolutionary for the healthcare system in future and for especially for remote patient monitoring at home. So we are Dozee. The company started in 2015. And I would like to start my presentation by showing you all a small video, which will give you a brief about that how do we work, what is our technology.
Here's what convinced me about the importance of having Dozee as a remote health monitoring device. We had an elderly patient living alone. Her daughter had placed Dozee under her mattress so that both she and us could monitor her vitals at the healthcare facility remotely. This one time we got an alert indicating a decrease in her heartbeat levels from the device. When we inquired her regarding that, she just brushed it aside, telling that she was just feeling a little bit tired that day and passed it off as an age-related problem. So we called her in for an additional medical test and found out that she had an abnormal heart rhythm, and ultimately she needed a pacemaker for that. Possibly without Dozee, it could have been fatal for her.
Dozee is India's first contactless remote vitals monitor. Its thin sensor sheet, once placed under the mattress, tracks person's heartbeat, respiration, sleep, blood pressure, and even tiny heart valve movements with medical grade accuracy. Once connected, the vitals can be easily monitored on the smartphone app and on a patient monitoring system, a centralized web dashboard where hundreds of patients can be monitored at once. This is how Dozee is helping hospitals to monitor the entire ward remotely.
So like you all have seen that how Dozee was helpful in saving our mother's life while her daughter was away and not living with her, and how easy the technique is. So in my further slides, I'll be talking about that what is the device, how do we use it, and what all we can measure from it, and what additional technology we have incorporated with the device. So about Dozee, we are an AI-powered contactless continuous remote patient monitoring system. And we provide a platform which facilitates early detection of clinical deterioration for timely intervention, both in home and in hospital, like Dr. Grewal said. So how does Dozee work? So Dozee has two things. The device has two parts. One is a sensor sheet, which goes below the mattress, and one is the Dozee pod, which is attached to a continuous power supply. Now, this device has to be connected to a home internet, so that all the data which is collected by the sensor sheet, which is placed below your mattress, gets all the data gets to via the internet, gets to a cloud, and then it can be viewed on a dashboard, which is available for the doctors who are monitoring the patient. And we also have a consumer app for the patient and his family, so that they can view their real-time data. What all parameters does Dozee capture? So the device itself captures heart rate, respiration rate, blood pressure, apnea, hypopnea index can be given. And we also give sleep quality parameters. We have some additional sensors which can be attached to the device. So we have SpO2 temperature, we can do a 12-lead ECG, NIBP, which is non-invasive blood pressure, and blood glucose level, which is obviously a roadmap, but we are planning to do that going ahead. The Dozee application is very interesting because that can also be used by the patient to enter a lot of manual data, which will be very useful in tracking their overall health, which includes they can add on their blood pressure, so their weight, BP, temperature, oxygen saturation, and interestingly, they can also upload all their additional lab reports. For example, if they have done an ECG or if they have done a blood routine. or a doctor has prescribed them a certain set of medicines, so they can even upload their prescriptions. So while they manually input all these things via this application, it gets automatically attached to the clinical dashboard, which I'll be showing ahead. So the doctor can view all the reports, all the prescriptions he has written, along with the vitals captured, and if they have any additional sensors attached. So for doctor, the whole dashboard becomes a one-place solution where he or she can track their patient sitting at their clinic and their patient is at home. So there are various type of alert system in Dozee. For hospitals, we use a Dozee early warning score, which is known as the DEW score. And for home, we use the advanced health intelligence alerts. So we have developed a AHI card module, which gives specific color cards on specific deviation of the vitals. Dozee, the device has also been has got certain quality certifications like IEC, ROHS, CDSCO. We are ISO 27001 certified. We are also in the process of getting the FDA certification ISO 13485 and GDRP. This is how the early warning system of Dozee looks like. So the first two, the DEW score and the manage alert is for the hospital system. We give them the DEW score is set on a basis of certain understandings. And then we have the advanced health cards, which is used for the home patient monitoring. So there are 4 types of advanced health cards. The green card, if it is visible. So first I'll tell that how these cards function. So whenever a patient gets onboarded on our system, the system basis on their height, weight, age, gender, will create a baseline of their healthy vital ranges. Then when the person will start using the device, for example, today, if it is the first night, then for the next 5 nights, they will take accumulating the data and processing, and then they will create a personalized baseline for the patient. So then how the cards keep appearing. So if somebody's heart rate, respiratory rate is within the baseline, that is within the healthy range, they receives a green card, which says that everything is healthy and there's nothing to worry about them. Then we have an orange card. If they see an orange card on their application, it means that their stress or sleep levels either were very, so stress levels were obviously, if they are higher than normal, or if they're not sleeping accurately, or they are sleeping more than what is advised. Then we have a red card, which is a high alert card, because the patient might have a high or a low heart rate or a respiratory rate above or below their baselines. So it's not like that only for 1 minute or for 30 seconds, the heart rate or respiratory rate was out of range and we'll receive a card. The formulation is done after a lot of studies that at least the card will, so at least the heart rate or respiratory rate should be above or below the baseline for a cumulative of 120 minutes, that is 2 hours. So this has been devised after we did a lot of research and did a lot of clinical data was checked. Then we have a gray card, which says that there were some data issues or the device was switched off. So gray card is generally to alert our team that the device is not being used, so that it doesn't happen that patient think the device is capturing their data and nobody is receiving the data. So these are the 4 AHI health, advanced health intelligence cards we use for the home system. So we have created a very dedicated dashboard for home patient monitoring, especially, so that if I am sitting in my clinic and I have 20, 30 or 40 patients who are using the device, so how will I monitor them? I cannot keep on checking everybody's data on an individual or a separate dashboard. So we have created a dashboard, which is a clinical dashboard for home monitoring. Sorry. This is how the dashboard looks like. On the first screen, this is the login screen. So if Dr. Apoorva is a registered doctor with Dozee, so all my patients who are registered with me will be available on my dashboard. So I can log in using my email or phone number. Now the second screen is very interesting because it gives me a holistic summary of all my active patients. So I have 20 patients who are using Dosi. I can see the data of my 20 patients on this screen. There are the 4-color AHI card tabs are there, so that I know that how many patients of mine who are active on the devices are on which category. So like you can see as a demo that 14 patients are on high risk. That means either their heart rate or respiratory rate for yesterday night was not normal or was not under the baseline. Similarly, orange, green and gray are there. Also, the doctor can see whatever extra clinical data the patient has entered from their application. So this is how they get a holistic view on one click. They can also then, according to their AHI cards, can check that how many patients have what type of card and what is their last alert, why is the card generated. So the dashboard makes the life of a clinician very easy to monitor their patients effectively. Also, the doctor can view the complete profile of one patient, that how was the patient behaving in last 7 days, 30 days, and how has then vitals been working, etc. So 2 use cases for the use of Dosi device. In hospital, we use it for connected HDU, VIP rooms, general wards, COVID wards. So we all know that there is a very huge crunch of ICU beds in India. So we, as a medical device company, what we are doing, that we are upgrading the system, that more number of beds can be used for monitoring the patients more effectively. Then at home, it is very critical. So at home, what happens? Sorry, 2-3 use cases which we have generally seen in home are: one, that if somebody has just been out of the hospital post discharge, so they need a very dedicated care, which obviously while the patient is in hospital, they know there are nurses and doctors around 24/7 who can monitor them continuously. But when they are discharged and when they come home, they are very skeptical that who will be there to look after me continuously. So there are 2-3 options. Either a family member is with them 24/7, which is practically in today's era not possible because everybody is working or the families are small, etc. Or they need to keep a nurse or a nursing attendant with them 24/7, which is one very high on the very heavy on the pocket. Second, it is not feasible for every family to keep a nurse or a nursing attendant with the patient 24/7. Third thing, if there is a chronic patient, if there is a chronic disease patient, for them also continuous monitoring is very important, because we don't know that if they are alone, there is nobody to take care how they are behaving, or will they actually report if they are not feeling well. Then obviously for elder population, 2 use cases for elder population. One, that most of the elder population today, especially in urban cities, they live alone. Their children might be in some other location or maybe abroad. So their children are also very worried about that how their parents are doing. And today they don't know how to track their parents' health. Today, the only method that they can, their parents seek help is if they inform their kids that they are not feeling well, or they are feeling uneasy, or they need to seek a doctor. So this solution, the Dosi device is also a solution for children who don't live with their parents, who really want to take care of their parents while they are away. So these are the few use cases where Dosi can be an amazing device in taking patients, in taking care of the patients, or if not patients specifically, especially of older population, when they are home away from their family, or if they don't have any caretaker which is available for 24/7. What are the benefits for the patients if I talk about? So there is an improved chance of patient safety because of the early warning system, and patients enhance experience due to contactless vital monitoring. One of the things which I have seen in the medical industry or in the patient care especially is that if I ask somebody, for example, my mom is a diabetic, or sorry, she's a hypertensive. So if I ask her to take her BP every day, she will do it maybe for a couple of days, but then it is very tough to inculcate that as a habit. So maybe they will monitor them for a couple of days and then they will not do it. or they will do it like once in a month or something. So because when we ask somebody to use a device on themselves, maybe they are using it or their family, it becomes very difficult. For example, if I want to check my SpO2 daily, I might not do it. But if I have something monitoring me without me doing anything, so once the device is placed under your mattress, you don't have to do anything. You just have to sleep on the mattress. So that is how the patient experience becomes, patient's experience plays a very vital role in monitoring them. Improved visibility and peace of mind for family members. Like I said, that if you don't live with your family, or if they're away, your children or your family can monitor your health very closely. And it also gives continuum of care from hospital to home, especially for patients who have been discharged out of hospital, maybe after a surgery or after a treatment for a chronic illness. So there is no break in the care. What are the benefits for doctors and nurses? Obviously, saving valuable nursing hours by automating the patient monitoring. Infection control due to contactless and remote patient monitoring. We all know that there are so many cases of secondary infections which happens in hospital. So if the doctors and the nurses know that there is a device which can take care of the patient while they are at home, so we reduce the chances of secondary infections as well. Improved mental health of doctors and nurses, because now they can work in a more easy environment. And improved clinical outcomes due to continuous monitoring and data early detection of clinical deterioration. And while their patient is at home, they also get early detection if the patient's vital signs are getting bad or they're falling. So what is our USP? First, that we are a contactless patient monitoring technology. We have a proven accuracy of 98.4%. We are also coming up with contactless blood pressure. It's in beta version currently, but we are soon launching it. We have early warning signs. Like I said, we use due score, periodic patient vital chart. So we also send daily and weekly health reports to the patient and the doctor. We can integrate various other devices like 12-lead ECG is done. We have also integrated NIBP, SpO2, temperature, etc. We have a dashboard which supports multi-location, multi-organization central command system. We have a very friendly mobile application for family and caretakers. Cloud-based architecture. We are an AI-based advanced health intelligence alert system for home monitoring. And we also give an empty bed alert for improved patient safety. This is also in beta phase, which will be released most probably by next month. So we have a very defined roadmap for Dosi, that we will be integrating blood glucose monitor, integrated wearables. We are also in the process of integrating a ECG chest patch, algorithm for pressure ulcer alerts, cardiac performance parameters, Q-SOFA score, and LTE connectivity. We directly don't prove that we are this accurate. We have run a lot of clinical trials with various hospitals across the country and have tested a device across the gold standard devices which are available and which are used by hospitals on a regular basis. So we have impacted, we are present in 288 hospitals, having 6,144 active beds. So this is what the last number is. We also stream these numbers live because we are increasing. The number of nursing hours we are saving daily, and the timely transfers which happen because of Dosi, that means we are directly saving lives. These are some testimonials by the doctors who have used the devices and shown us trust for the device, given their valuable feedback as well. We have worked with various hospitals and government organizations, government hospitals, where we are already available. They are using our technique and making the healthcare better. It's a technology-driven company. We have won various awards for our innovation technology. So this is what Dosi is. It's a contactless remote patient monitoring system used both in hospitals and home. Over to you, Dr. Grewal. We are open for
Thank you,
questions.
Apoorva. Thank you so much. The new technology, and why I'm excited about it is that a number of times, we'll have our comments from our expert just now, number of times as a standalone clinic doctor, when you want to monitor some patient at home, just because you're not confident that you will be able to monitor it, you do many a times refer the patient to certain hospitals or smaller nursing homes. So Dr. Harshvardhan, I welcome you for your comments first, and then I'll put one or two questions which I've got. So Dr. Harshvardhan, your concept, your impressions about home monitoring and by this system, please. Welcome, sir.
Thank you, Dr. Grewal. Dr. Apoorva Garg has really given a very nice presentation on the subject of remote monitoring. The concept is really good that you can monitor the patient, but as we all doctors know that the basic purpose of monitoring is to treat the patient. When we are monitoring the patient at night and nobody is available and patient requires any treatment at that time, what is to be done? I think that is one issue that needs to be sorted out. Number two is in the hospital environment, it is all right. When the patient used to be in ICU or coronary care units, and when the patient was sent to the wards, many times patients were put on telemetry where their heart rate, blood pressure, etc. could be easily monitored. And they were connected with the CCU central monitor, and one could easily detect and bring back the patient to CCU whenever required. And this will be a good substitute for them because it will give a contactless monitoring for such a patients, and the patient can be immediately taken care of. So far as this is concerned, it's an excellent substitute for telemetry in the hospital for the patients who are being stepped down from the CCU or ICU. But the problem will arise from stand-on clinic. Which are the patients exactly which you should be monitoring, and what step you should be taken if something is detected, say at midnight, 2 o'clock or 3 o'clock, what will be the medical legal liability for that? What are the group of patients that should be put on these devices by the standalone? Because there can be a lot of medical legal issues. If we see the AHA had issued position statement in 2019, where the indication which they said for the control of blood pressure, for early detection of atrial fibrillation, for management of heart failure patients, for early detection of deterioration, etc. So those things are all right. But for a patient who is not suffering from these diseases and is sick, monitoring those patients with the devices at home could pose certain problems. This is one thing. Another thing, you are monitoring with this contactless monitoring when the patient is on the bed. What about his monitoring during the daytime? Another question I have for Dr. Apoorva is, what is the technology for using the blood pressure by contactless? So how do you measure the blood pressure?
Dr. Apoorva, please.
I think if Apoorva can give and she can give her comments on my questions raised by me.
Okay. So Apoorva, you could just collect the questions and so the two very important relevant issues which Professor Harshvardhan has raised. One, what is the technology by which BP is measured? Number two, a totally patient in bed versus a patient who's mobile. What would be the dynamics and the benefit of having such monitoring done? These are two questions, Professor Harshvardhan. Yeah.
And which are the patients which she recommends that should be monitored at home by a standalone clinic?
So before she answers, let me ask you one question, Professor Harshvardhan. Now, they are at the moment providing heart rate, respiratory rate, blood pressure, and sleep, sleep apnea index. With these four as fundamentals, do you feel that the monitoring, level of monitoring can enhance by a certain percentage for the moment by these four parameters?
We have some already monitoring devices available, which can be one on the wrist. They give you heart rate monitoring, etc. But point is that which are the extra patients where you like a remote contactless monitoring by a standalone doctor and the patient at home.
Very good. So I think what Professor Harshvardhan is leading us on to, what he's leading us on to is I have introduced that the standalone clinics के लिए एक नई चीज आई है. What the expert is leading us on to, that tomorrow if I advise it to a certain patient and I do get a red card, then what do I do? That is,
Monitors.
yes. So how will
Yes,
I
suppose in
use it?
monitor-
That's right. That's right. I think it's an important one. So I
Yes,
think we'll
suppose-
break it up into two parts. We'll break it up into two parts. One part will be that yes, getting these parameters is useful. The second part is how will be the process of utilizing the data. So I think Professor Harshvardhan, you agree that these are two separate.
Yeah, I think that is very important. Data
So I
collection
think
is one thing.
he's given us a path to take up, that we would first, maybe in a subsequent session. I welcome Gaurav Parchani on the show. Mr. Gaurav is the co-founder and head of the technical division at Dozee. Welcome, Gaurav. Nice to have you.
Thank you. Thank you,
So,
Dr. Grewal.
I think Professor Harshvardhan is setting the path for us that when we talk about Dozee, we would, as subscribers of Dozee, do list these safe areas, safe patients on which Dozee can be given immediately by a standalone clinic doctor. I think that is an important input that he's given. So I think Apoorva and Gaurav, you can work on this, that which are those patients you, we'll request Professor Harshvardhan to be available to us subsequently, and you can have a chat with him or write to him that which are those criteria of patients. Like if I'm monitoring a hypertensive patient who's, I suspect having a PAT, maybe Professor Harshvardhan, maybe that patient I could immediately use benefit of the Dozee. Then would be the most serious ones. So it will be useful, as every gadget. Why just a gadget? Even a bicycle. When used appropriately, it gives best results. So what Professor Harshvardhan is saying, that appropriate use of it is good, but over a period of time, we have to develop the appropriateness of the. Now, Gaurav, if you can answer that, or Apoorva, whoever, that what is the technology used for the blood pressure?
Sure. Awesome. So, great questions, Dr. Harshvardhan. As in, these are some of the really, as in areas that really need a lot of work, specifically in the health tech space. I'll quickly cover the technology that we use for blood pressure monitoring, and then post that try to answer some of the questions that you've kind of put out. But as I think, as Dr. Grewal said, it's a participatory approach where all of us need to come together and kind of answer these questions collectively for it to be adopted at a policy level or at a level where it can kind of be standardized. The basic principle behind Dozee, how it works is it captures vibrations from underneath the mattress. When a person is sleeping on Dozee, it's capturing the vibrations that the body is producing. These vibrations are because of cardiovascular and pulmonary function. So each heartbeat, each inhale, each exhale, each snoring event, each body movement is captured in these vibrations. We extract patterns from these vibrations, and that's how we identify heartbeats, we identify respiratory cycles, and that's how we get heart rate and respiratory rate. Blood pressure, on the other hand, is actually not so intuitive. We've been working on it for almost a year now. And the methods of measuring blood pressure, predominantly you can classify into three different parts, or actually two right now, and we are introducing a third one. The first one is essentially an ABP monitor, arterial blood pressure line, where it's a very invasive process in nature, and you have to put generally only a few percentage of patients who are already in ICU are only put on that. It's an invasive method, risky, but it's the most accurate one. The second one is the cuff-based method, where the cuff is put on, whether it's done manually through sphygmomanometry or whether it's digital, but a cuff inflates and takes that. We also have that option at Dozee where you can connect an accessory and take that. However, we're coming with a third one, which I said, which is not just non-invasive blood pressure, but we've added one more layer to it, and we call it non-contact blood pressure, NCBP. Here, essentially, we monitor the energy of the signal or the force of the vibrations that are being exerted through the mattress, and we track the trend of the blood pressure through that. So whenever a person comes on Dozee, we ask them to lie down on the mattress and calibrate their blood pressure value once with a cuff-based measure or something like that. And after that, it starts giving you a blood pressure value based on the trend of the energy that's capturing from that. It's a very novel technique. We've filed a patent on it just a few months back. And on top of this, we've collected data for more than 50 subjects in 2 hospitals on both cuff-based monitoring, a continuous monitoring where every 1 hour a cuff-based blood pressure reading was taken, and an arterial blood pressure line also where every 5 minutes an ABP was reading as a gold standard.
Okay,
So,
just 1 minute. So what you're saying is that the blood pressure readings from your Dosi compared to the cuff instrument are same.
Yes, the trend is very similar, and the accuracy is approximately more than 80% when it comes to plus minus 10 mm of Hg. Right, so we are working on it to get it much more validated. Right now, it's just 50 patients in 2 hospitals. Target is to get it to more than 150 patients very soon, and publish all of this data out for it to be consumed in a much more mass manner. Right now, we've put a sticker of beta on top of it because it's in the process of validation and we are developing these algorithms as we speak. But yeah, it's one of a kind. It's the first time somebody has done this in a non-contact, which actually brings me to a separate answer of the question that you had. Why don't we use some other gadgets that are available? Why do we use Dosi? Right?
Just 1 minute, just 1 minute
Yes.
before. Professor Harshvardhan, has it answered your question about what is the technology which is being used for blood pressure?
I think technology is because with other devices also, we use sometimes similar type of devices, but there's a good contactless device. But only thing is it needs to be validated because we are going to base our treatment on the basis of the data received with this device. And before we have that, it needs a validation, which still has not. I think still it is validated. We cannot rely totally on the readings obtained by the blood pressure with this instrument.
Absolutely. For example, yeah, absolutely. So, for example, we remove the beta sticker from our heart rate, respiratory rate after validating it at 3 separate hospitals in 3 separate geographies. At NIMHANS, at Sparsh Hospital in Bangalore, and we also have one of the clinical trials active right now in the US as well. As we speak, our US FDA application is also in the progress. So within a couple of months, we should also, as in we are planning to get US FDA also to our Dosi device. But you're absolutely correct. Validation studies are very, very important. And this is healthcare where you need to be very precise in terms of what the device does and what it does.
So I think 2 things emerged from Professor Harshvardhan's question. 2 things. One, he has asked about the technology which you have provided information. And what the second part of his question was that which are the select groups where Dosi monitoring has enhanced the quality of care? Can you throw some light on that, please?
Absolutely. So, as Dr. Apoorva mentioned in her presentation, we have 2 Dosis, one for home, one for hospitals, and one for home. For hospitals, it's a very clear use case where we create a step-down ICU or a connected HDU, high dependency unit. It's a buffer between the ICU and the normal general ward. So, a patient very risky for a general ward, but not risky enough to be transferred to an ICU can be admitted to the HDU or a Dosi bed. If in case a Dosi bed is not available, an ICU bed is not available, then also they can be, we've seen hospitals using a connected HDU bed or a Dosi bed for a step-down ICU monitoring purpose. Also, patients that are being discharged out of the ICU and being transferred to the ward first go to the HDU because the monitoring aspect, like the last 1 day or last 2 days where they're in the ICU just for monitoring sake, they're actually transferred to the HDU so that the ICU bed is made available for a patient that requires surgery. So it's actually increasing throughput of the ICU also. But on the home side, this is exactly where things get tricky. On the home side, patients are not really at very high risk where there is an imminent threat or let's say an imminent threat of health deterioration. We've seen progression of deterioration happening over weeks or over days. Traditionally, we've seen as in a lot of scope in the cardiac space where patients post heart failure or heart surgeries and patients post any complex surgeries, be it a severe trauma surgery or be it, let's say, an organ transplant or be it a kidney surgery for a specific period of time. Now that time can be different from doctor to doctor. It can be 15 days, it can be 30 days, or it can be 6 months as well. Till the clinician is satisfied that the patient is out of the danger zone and no further monitoring is required. So that's exactly where we've seen this.
Given Professor Harshvardhan, if I have to be the devil's advocate, given the benefit that the readings would be accurate, and given the credit to the judgment of the doctor that he has applied the Dosi at an appropriate patient, what do you think that in the coming time, maybe months, this type of technology, where do you think, can you feel that it will help you as a cardiologist, would be useful in your practice? Given the doubt that yes, it is going to be accurate and helpful.
You see, point is the technology will definitely be useful, but I think we have to define the conditions where it will be useful and not harm the patient. And I think the conditions that are, number one is the control of blood pressure, which it can be very useful because you are monitoring the blood pressure and you know the trends of blood pressure and see whether the blood pressure is properly controlled or not, because the mortality and morbidity long term depends upon the proper control of blood pressure, we all know. And hypertension is definitely a big problem nowadays, with almost 1/3 of the population suffering from it. And we know people are not much aware of it. Even those who are aware of it, the blood pressure is not properly controlled. So proper control of blood pressure is very essential. That also makes the patient conscious, and it has been seen in trials that patients who use
that over a period of time, Dr. Gami has also asked this question, over a period of time, the present ambulatory blood pressure recording system, which is done at the patient's home, will Dosi be sometime, can it be an alternate to that system, please?
No, it will not be. That's what I was trying to ask, that this is when the patient is sleeping and you have put it under the mattress. What happens during the daytime? That question has still not been
answered. Yes, that was
once I know that, then I can say whether it can replace the ambulatory blood pressure monitoring or not. Because in ambulatory blood pressure monitoring, the patient is ambulatory and doing his normal activity. Here, the patient is just lying and you are monitoring. So whether this device can be used in an ambulatory patient or not, I have
Absolutely, sir. So, if I may just quickly answer that, we are working on collaborations and integrations with multiple wearable sensors to cover 24/7. But sleep monitoring in general also comes with a very useful use case, because it helps us identify the baseline of an individual without an external stressor. Ambulatory is definitely very, very important, but the sleep part gives us a baseline on a day-to-day basis. Right now, we have 55 million cardiovascular patients in our country, and we just have 5,000 cardiologists taking care of them. Right, so the number is very, very skewed. Most of these patients are under no monitoring whatsoever. So right now, when we discuss of usage of Dosi, in predominantly 95% of the cases, we are not replacing anything.
I think Gaurav, the fact that we also, I think, if you see the topic, Professor Harshvardhan, it says vitals. So information which may not be on a long-term basis, but on a short-term, in permitting me to take vital decisions, whether this person needs to go to ICU or not, whether I can shift him out of the ICU. The pertinent question what Professor Harshvardhan said, how will it help a standalone clinic? Because we are talking to people who are standalone clinic doctors. So I think we will, in due course, it is just, as I said, Professor Harshvardhan has shown the roadmap to me already, that a session specifically mentioning where are the indications where Dosi would make a difference. A special session on this should be organized, where with your past experience of where it was used, and show that figures of how a standalone clinic doctor, we are interested, I mean, to be very selfish, send a patient to the hospital, I'm not bothered. I'm more concerned, how will it help my practice? आपने मेरा रोकड़ा बढ़ाना कि हॉस्पिटल का बढ़ाना, मैंने को तो अपना बढ़ाना भाई, तो मैंने अपना रोकड़ा बढ़ाने के लिए I want to see what more can I give a patient so that the patient does not have to be rushed to the ICU. Then I will improve. I'll improve my quality of care and I'll be able to improve my income. So I think Professor Harshvardhan has given me the direction that we need to talk more about which are those conditions in a standalone clinic where Dosi can be used to enhance my quality. I think, Gaurav, that will be a good, nice discussion we can have.
Absolutely, sir. Anytime. And as I said, it's a collaborative approach. We're looking
that's
forward
right.
to.
It's a win-win one. Well, we have a question from Mohit which says that when heart rate, respiratory rate, blood pressure is monitored in bed without touching to pulses veins, does it compare? What are the comparisons with ICU monitor? I think that was the question what was Dr. Harshvardhan was also asking. That a difference between the cuff instrument and the Dozee one, which you've answered. Dr. Radha is asking, where is Dozee available? Dr. Radha, just give us a minute. We will be giving details about that just after this question answer session. So I think, Dr. Poonam, would you like to, as a surgeon, because what we are saying is that this Dozee is not just for cardiac cases, it's for even post-surgical cases who have just gone home. And there is always a concern in the doctor's mind, कि आप घर जाके blood pressure check करा लेना, मेरे को ये बता देना, मेरे को respiratory. Now these days with the COVID, we are telling everybody to keep taking the oxygen every 5 minutes. And as Apoorva said, there are people who get lazy to find out. So it's a good, availability of a good armamentarium in our tool for care of the patient. So, Professor Harshvardhan, any other questions you would like to ask before I put up some 1 or 2 questions? What is the life and investment cost of Dozee? What is the life of a Dozee?
So, yeah, as of now, we figured out the life of Dozee is more than 3 years. The oldest Dozee has been working for 5 years now, under my parents only. Both of my parents, yes. On the investment cost, the idea is that for hospitals, again, it's a subscription cost. They have to pay per day, as in per day, the cost of Dozee comes out to be approximately less than a cappuccino in Starbucks. So both in government hospitals as well as in private hospitals, it's very, very accessible and affordable. At home, there will be a fixed cost along with a subscription cost, which will be yearly in nature. Like your DTH Tata Sky model, similar model, and it will be very, very affordable and accessible.
Well, my feeling, Gaurav, is that I think I would like Professor Harshvardhan's word on this also. I feel the indications aayenge, it will differ from each patient to patient. Somebody might be wanting, say, if Dr. Harshvardhan has done a patient with discharge from ICU, he just needs about 3 weeks to 6 weeks of monitoring. So, what do you say, Professor Harshvardhan?
No, I think before I answer that question, I have 1 or 2 queries from Dr. Gaurav. See, as of today, when I have to remotely monitor a patient, what do I monitor him for? Supposing a patient comes to me with a syncope, I want to find out what is the cause of syncope. I put him on the Holter monitoring, which is the type of the remote monitoring. If the patient is complaining of palpitations, I put him on Holter monitor, which may be for a day or maybe for 1 week or 2 weeks, and try to find out what is the cause of palpitations. Then if I'm not able to pick up the symptoms, I sometimes advise the implantable monitors also, which keep on monitoring for a long period of time to find out the cause of the symptoms. This is number 1. Number 2, I think where the remote monitoring is being useful is the control of blood pressure, where even the randomized trials have also shown that the remote monitoring of blood pressure really helps in better control of the blood pressure. But besides this, it has been used in early detection of atrial fibrillation, because we know that atrial fibrillation can lead to stroke. And if we detect early and put them on treatment, it will help these patients if they are detected early. Then is the heart failure patients, where we want to detect the early deterioration so that we can prevent the hospitalization of the patient by increasing the dose of diuretic, etc. By these, I think this is the group of patients where definitely your Dozee can be helpful. But in other condition, I am skeptical whether it will be useful or not.
I think Gaurav,
Absolutely correct, sir. So one of the studies that we are initiating right now in 6 cities is actually post-identification of heart failure, grade 3 and grade 4 heart failure cases, where we want to document the exact efficacy in terms of if we generate an alert, what is the efficacy, what is the specificity and sensitivity of the alert, what is the alarm fatigue that we're causing, so on and so forth, and document all of this in place and actually quantify the benefit, better patient outcomes, and the other things. Yeah, sorry. Yeah, you're absolutely bang on, sir. These are the long-term use cases that we are focusing on.
These are for all the audience listening in. Here's an expert cardiologist and here's an expert machine man. So they are talking amongst themselves and maybe going over our heads. But remember, once the expert start using it, the usage percolates down to me also. So what Professor Harshvardhan is wanting to know, and over a period of time probably, as you're saying that your research work comes with information and the utilization increases with more evidence, then obviously we'll start getting the benefits to my standalone clinic level also. So it's important that today things move so fast. I think Gaurav and Apoorva, you started this whole project how many, 3 years ago?
So we started Dosi almost 6 years ago. But the home monitoring piece has just been picked up in the last year.
Well,
We've been focused on hospital. Yeah.
Well, even 6 years is a very short time for somebody to come up with that technology and come up here, because things move fast. And the more you're questioned, the more you're improving. So I think, as you said, it's a win-win situation. Dr. Harshvardhan is clearly saying that there are areas where Dosi will definitely be useful. Once we share those areas with you, you can adapt and come up with a solution to us and empower us to give better services. I think I'll just take one more question. Dr. Arun Dugal says, what should be the precautions taken by the patients using Dosi? Okay, that's to improve the reliability of the results as well as to increase the life of the gadget. Can Dosi give electric shock?
No, so it would not do that. We've tested Dosi under IEC 60601-1, -2, and -10. What that means in layman language is that it's completely safe to use. As it goes under the mattress, you're not going to move it again and again. So as I said, the life of Dosi is more than 3 years. You don't have to worry too much about it. And trust me, if you have an active subscription, we would replace Dosi at any point of time if it goes bad. For us, your health is way more important than the hardware itself. But as I said, it's completely safe to use. You don't have to be bothered, and it's very unobtrusive in nature, so you don't have to be bothered that there is something monitoring you.
And Gaurav, it comes on the app on a phone, isn't it?
That is correct. So it comes on the app.
Apoorva just showed those 3 charts. So remember,
on both iOS and Android. Yes.
Reading from the patient will come onto the phone, and you will read it on the app. And if there is something more variation, there are alerts which come into me. That's what I think I understood. Fine.
Yes, absolutely.
Dr. Gaurav, can I give you one food for thought?
Yes, sir. Please.
I think rather than monitoring cardiac patients, if the respiratory patients are monitored, say sleep apnea patients,
yes,
those are already on BiPAP or CPAP, whether that is working all right or not, that will be far more useful for a standalone clinic rather than monitoring the cardiac parameters, which can sometimes land them in trouble also.
If they can't do anything about it.
For a standalone clinic, the respiratory assessment, patient of sleep apnea who are already on BiPAP, CPAP, whether they are being well controlled or not, whether they need any adjustments or not. In those group of patients, probably it may be more useful in standalone clinic rather than in serious patients which require cardiac monitoring.
Very important. And I think
we've seen that use case, sir. It works really well in that case.
Professor Harshvardhan has given us another task. You see, Professor Harshvardhan, this network that we are trying to build, the Mera Swaasth Physicians Network, we are also trying to get on board specialist experts like you, whom we want to have a liaison with our members, so that in an eventuality of any opinion to be taken, you would be forthcoming to give us an opinion through a WhatsApp system. So as soon as you're already on board, we've taken you on board, whether you have your second thoughts, we don't bother. You are on board. So when I'm trained enough, if I have certain vitals which are coming on a red signal, I can straight away send to Professor Harshvardhan and get a feedback. So there will be ways to circumvent the legal issues about it once the advice is coming from an expert. I think that is the future. That is the future. Where I can use it safely, where I can use it with caution, will be 2 separate areas. But the fact is that if I can use it, I must use it. So I think there is a surprise announcement by Dosi. Now, I don't know who's going to make that announcement. Atul, would you make it or would Gaurav make it? To all the attendees, there is a surprise announcement by Dosi. Please go ahead.
Yeah, hi sir, good evening. So first
Yeah,
of all,
good evening.
thanks everyone for joining this remote patient monitoring session, and especially on a weekday. The announcement which you have seen on the invite as well. So we're happy to announce that we'll be giving 2 devices for your patients for 1 month for demo. We have a command center set up in Delhi where we have a medical person sitting there. So we'll be sharing the daily reports, the weekly reports of your patient with you so that you can see how Dosi works. So
I think
whosoever is interested, please reach out to Dr. Grewal. I'll be putting my number in the chat box as well.
Yes.
Yeah.
So thank you, Atul. I'll repeat the offer. All the people who are doctors who are on board today attending, Dosi is offering them 2 free monitoring systems for any patient or themselves for a period of 1 month. They have already got a command system based set up in Delhi. So once the command system, the data from that will go to the command, and you will be provided information from there on the interpretations from the command, a doctor sitting there interpreting it. So that's the offer to all of you. Please, if you want any of your patients, two patients per person, you can send your requests on a WhatsApp number to me, or Mr. Atul, you can share your number. And I think if Professor Harshvardhan wants to have 2 patients in Jaipur, I'm sure Atul, you'll be able to arrange it for 2 of his patients at Jaipur also.
Yes, sir.
Right.
You have a command center in Jaipur?
Sorry?
As of now, sir, we are in Delhi, but hopefully we'll be setting up a command center soon there as well.
Well, you can start with Professor Harshvardhan.
Sure, sir.
And before I ask for the vote of thanks, let me share with you just one line about the Mera Swaasth Physicians Network, which some of you may not be knowing. Well, this is a network which has primarily been started to answer one question. A lot of you today must be feeling that you are once again vulnerable and you are having issues like these at your clinics. The disease pattern has changed, equipment has changed. For example, today you will be providing Dosi to some of your people. Patients, because the non-communicable diseases are higher now than communicable diseases, patients' expectations are same as it was during communicable diseases. So the bukhar 3 din mein nahi gaya, diabetes to 3 saal mein nahi gayi. So the patient expectations have changed. And the perception of patients is, ye bimari na aapki clinic pe nahi ilaj hoga, bade hospital mein jana. So that is a perception, whereas you can provide much better care. So something needs to be done, and we have been debating and discussing what can be done. And therefore we realize one thing, that vertical growth is difficult in this present system, because vertical growth may require a lot of investments, a lot of infrastructure, which may not be available to a standalone clinic doctor. So therefore, the solution which is there is you go lateral, but go under one brand. Because if one brand comes up, then all the physicians who are under that brand automatically get strength from the brand. So if Dr. Arun Dugal is in Gurgaon and Dr. Sunil Kapoor is in Pahalganj, but both of them are called Dr. Sunil Kapoor's Mera Swaasth Clinic and Dr. Arun Dugal's Mera Swaasth Clinic. So the Mera Swaasth Clinic becomes the brand under which the network is working. So that is our concept. We have already got the website ready. And in due course, we will be coming up with an advertisement in the newspaper once we have about 150 physicians from different areas in Delhi. So I once again thank all of you to joining us. A special thanks to Professor Harshvardhan for having spared his time from his Department of Cardiology work at the Gandhi Medical College in Jaipur. And thanks to Dr. Deepika Chhabra from Jagsonpal, who just on a phone call is arranging all the logistics for us, and the slide presentation and the webinar. So thank you so much, Deepika, and thank you, Jagsonpal, for helping us. Apoorva, for your presentation. Atul, have you given your number on the chat box, please?
Yes, sir, I have mentioned
Yes,
it.
yes, yes.
Yeah.
Dr. Mohit, the number is in the chat box. You just asked about the number. So it is 8800446680. Mr. Atul Kumar, Zonal Head, Sales Head from Dosi. You can send it to him, or you may send it to me. I will forward your questions, your requests. So 2 names per person. They're not stingy. Agar 3 bhi dena ho to de dena. Naraz nahi honge. Gaurav, I'm sure. So
Absolutely, sir. No worries. No worries.
And so please get in touch with Professor Harshvardhan at Jaipur. And thank you very much. And look forward for the next week presentation on Thursday, 4 p.m. Most likely it will be on a program, on a government program, which is Anemia Mukt Bharat. It is a very simple program which all standalone clinics can run. Whether you're an orthopedic surgeon, you're an ophthalmologist, or anybody, everybody come into your clinic and have an anemia test done. And that comes under Bharat Mukt program. It's a Government of India program, so we want standalone clinics to run Government of India programs so that our contribution is accepted and seen by the government. Thank you, Professor Harshvardhan, once again. Thank you, Deepika. Thank you, Apoorva. Thank you, Atul. And thank you, Gaurav. Many more such sessions on Dosi. Let me tell you, it's a new product and it's conceptually exciting, but many doctors don't accept such delicate technology straight away. And therefore, it's important that experts like Professor Harshvardhan come up with questions and suggestions. So thank you for the roadmap you have given us today, Professor Harshvardhan. Thank you very much, and God bless you all. And this session will be available on YouTube, Deepika?
Yes, sir. We'll put it up on YouTube, and currently the Facebook live link that can also be viewed later on. The recording stays there.
Right. Thank you, Dr. Kailash. Thank you, Ashwini Malhotra, for your encouraging words. And thank you, Dr. Dugal, for your encouraging words. It's a pleasure. I'm very happy when doctors communicate on chat box because they're not very often using the computers. Thank you, Amit. You have appeared suddenly like, who was that Hrithik Roshan movie in that he suddenly appeared? Wo, kaun tha?
Jadoo.
Jadoo. Right. Thank you, Dr. Vinod Raina. Thank you very much. He's a world famous sexologist. He's also acknowledging the Dosi. So thank you very much and good night.
Good night.